What are the functions of your calf? So it helps with plantar flexion, which means pointing of your foot down, and it helps with propulsion because of that reason. Athletes that have majority of pushing off moments during the sport, that starts a force couple, so those muscles are pushing off like that, and if there are not proper things in place to actually prepare the muscles for that impact of force can actually cause tearing in that muscle. Also, a lot of activities that actually engage start and stopping. So if you are running and doing like a quick stop or a start, like when you're playing soccer, for instance, when you're going up and down the field, you have to do quick starts and stops. Tightness in the calf could be coming from something up higher. We call that the chain. So pretty much anything down low can be affected by something up higher, and this would be the posterior chain or the back of the leg chain. So you could be having some hamstring strength issues as well as weakness going on in the hips, more specifically the glute muscles. That all will have an effect going down that leg. You are also likely to have tightness in the hamstring because the gastroc, which is that outer muscle, and the hamstring are both muscles that cross the knee in the back. So anytime you have a tight gastroc muscle, you're more than likely going to also have a tight hamstring muscle. And like I said before, that goes all the way up the chain. If you have a tight hamstring muscle, that could be pulling on your low back and therefore cause issues like back pain as a result of that. So anything starting up higher can cause anything going down lower, and anything lower can actually come up and cause some issues going up higher. So how else can this impact your everyday life? Normally when we stretch, we do produce some micro tearing in the muscle, which is normal, and that's a way of lengthening the muscle. But if you're doing a lot of pushing off and propulsion, quick starts and stops, all those different activities, that can actually cause micro tears that do not heal. Also, you might notice shin splints, and that's because muscles in the front of the leg, more specifically the muscle called the anterior tibialis, which is on front of the tibia of the inner side of your leg, can actually get super overused because of the calf not being stretched out. So you should be wary of that, because anything with running can cause shin splints in the front of the leg as a result of that calf muscle being tight. Stress fractures, another thing with having calf tightness, is because there's shortened muscles in the back of that leg that can also cause abnormal impacts on your bones, more specifically the tibia bone, where that would cause microfractures going on in the actual bone itself. And then finally, something that's really serious is called compartment syndrome. There's different compartments of the lower leg, but if you have a lot of calf tightness and you're doing a lot of exercise, compartment syndrome could occur when there is an excess amount of pressure that builds up in the muscles, and with that leads to decreased blood flow, and then that could lead seriously to surgery, where they actually have to go in and release the pressure from those muscles. Finally, physical therapy is an awesome option if you're noticing that you don't really know what to do and you're participating in sports, or you're just running or participating in your own exercise program and you're having pain. The best thing to do is go to a physical therapist, because we can actually evaluate the problem and determine where the origination of the problem is coming from. So like I said, you might have tight calves, but is your glutes and your core up here, are they too weak, and we need to address that. The other thing is we can help with fitting you or suggesting proper shoe wear. A lot of people will go to get their own sneakers and not pick the correct sneakers for their support. So we can assess your actual foot and ankle, tell you what is the proper shoe wear, and then have you go ahead and go get those. Also, we can assess your gait. We can watch how you run. If you're not having good form, we can address that and teach you how to then improve your form. And then also we provide some manual treatment to you to decrease tightness in the calf, increase blood flow and circulation, to help with that stretching component. And the biggest thing is obviously the home exercise program. We can give you the tools to be able to help handle that during your time in physical therapy, but more importantly, to make sure you have the tools to be able to handle that after you're done. So if you're interested in looking more into having a physical therapist check you out if you're having pain, we would love for you to come in for an evaluation. Just click the link below and we can get you set up for one as soon as possible.